Imagine a perfect treatment for a failing heart. The surgical procedure is flawless, the new valves work beautifully, and the biological problem is solved. But 6 months later, the patient is back in the ER because they struggled to manage their stress levels or follow a complex medication schedule. Focusing strictly on physiology often overlooks the human being who must manage that physiology. A successful surgery is only the first step in a much longer chain of human decisions. This illustrates the biopsychosocial model, which accounts for these variables. It acknowledges physical health is inextricably linked to our social environments and psychological states. The psychological component traces back to two Greek roots, psyche, meaning soul, and logos, the study of it. While the origins are philosophical, the modern discipline is empirical. Today, psychology is the rigorous science of behavior and mental processes, relying on controlled experiments and systematic observation rather than speculation. When a care plan ignores the science of behavior, its effectiveness depends entirely on luck once the patient leaves the clinic. Clinical precision in the operating room does not guarantee a recovery in the living room. Today's most pressing medical challenges are often chronic conditions that develop over decades, heavily influenced by daily lifestyle choices. Health psychology studies exactly how these choices, our habits, social circles, and mental states, interact with physiological processes to influence the onset and course of illness. This flowchart tracks a specific biological mechanism. A psychological stress trigger prompts a release of cortisol, which over time can lead to a sustained increase in blood pressure. To address these habits, medicine utilizes behavioral psychology. Rooted in the work of figures like B.F. Skinner, this branch focuses on observable actions and how behavior is learned, reinforced, or modified. By utilizing principles of conditioning and reinforcement, healthcare providers can help patients replace harmful routines with sustainable, health-promoting ones. These techniques are the primary tools used in successful smoking cessation programs, weight management protocols, and systems designed to improve long-term medication adherence. Health and behavioral psychology provide the operational framework that ensures medical advice is successfully translated into a patient's daily life. Physical medicine also frequently intersects with acute mental distress and varied cognitive capabilities. Clinical psychology focuses on the assessment, diagnosis, and treatment of mental health disorders, helping patients manage conditions like severe anxiety or depression alongside their physical care. In integrated settings, clinical psychologists work with physicians to stabilize patients with dual diagnoses, ensuring mental health crises don't derail physical treatments. However, a patient's psychological needs are not static. They shift as we age, a progression studied by developmental psychology. A young child and an elderly adult possess vastly different cognitive and emotional tools. They perceive their illnesses and interact with their providers in entirely different ways. By understanding these age-specific changes, medical teams can adapt their communication and care plans to match the patient's developmental stage. Clinical and developmental psychology provide the specialized knowledge needed to tailor care to a patient's specific mental stage and stage of life. This matrix shows how health, behavioral, clinical, and developmental psychology combine to create a comprehensive behavioral science toolkit for modern medicine. This approach relies on systematic observation and data to accurately predict and modify the behaviors that drive health outcomes. Modern care is moving away from a model where physicians and psychologists operate in isolation, favoring cohesive, integrated teams. Effective treatment now requires an understanding of emotion, motivation, and cognition as core components of patient health, right alongside anatomy. The most advanced biological treatments still require a human to act on them. Psychology provides the bridge between a physician's prescription and a patient's daily reality, turning medical potential into measurable health.